We are currently estimating something over 400 million people with diabetes today in the world.
We like to describe this as a global catastrophe in slow motion. So if you put together the productivity losses, you put together the healthcare costs, the medical costs, it's astronomical.
Imagine navigating your way through a dark forest without a compass. The danger lurks around every corner, but you remain oblivious, unaware of the impending harm. This is exactly what happens inside our bodies when diabetes silently seizes control.
I was shocked when I found out I had diabetes. Suddenly, I had to give myself an insulin shot in the stomach.
This seemingly elusive condition, often known as the silent killer, gradually encroaches upon our health, leaving clues in its wake. Recognizing these symptoms of diabetes is likened to finding our way out using a compass as our guide.
But managing the ABCs of diabetes can lower the chances of heart attack, stroke, or other problems.
Diabetes is a chronic condition that affects the body's ability to convert sugar, specifically glucose, into energy. Glucose is an essential fuel for the body. However, if not managed properly, high glucose levels can damage your heart, eyes, kidneys, nerves, and other body parts. In this video, we'll take a closer look at 10 warning signs of diabetes, and if you stick to the end of the video, we will explain why the number one reason should not be ignored. Your life depends on it. Frequent urination. Excess sugar buildup in your bloodstream causes fluid to be pulled from the tissues. This may leave you thirsty. As a result, you may drink and urinate more often than normal, typically more than 3 liters a day for an adult. While the frequency can vary depending on fluid intake, for most people, the normal number of times to urinate daily is between 6 and 7 times in a 24-hour period. Increased thirst. In diabetes, your kidneys work overtime to eliminate the excess sugar in your bloodstream. This process creates a cycle of frequent urination, followed by intense thirst that can't quench no matter how much you drink. While it's normal to feel thirsty after certain activities like intense exercise or eating salty foods, polydipsia describes a persistent and intense thirst that lasts for days, weeks, or even longer until your blood sugar is normalized. Persistent hunger. Diabetes prevents your body from properly utilizing glucose for energy. As a result, your body, especially your muscles and organs, may be energy-starved, causing intense hunger. The more you eat, the higher your blood sugar gets. Unexplained weight loss. Despite consuming more calories to mitigate hunger, you might still lose weight. Without the ability to metabolize glucose, the body uses alternative fuels stored in muscle and fat. Calories are lost during this process due to excess sugar in your urine. When blood glucose levels are too high, your kidneys are unable to reabsorb all the glucose and excrete it in your urine. This also means you're excreting calories, which can lead to weight loss. Fatigue and weakness. If your cells are deprived of sugar, you may become tired and irritable. Also, dehydration caused by frequent urination can cause these symptoms. High levels of sugar in the blood can lead to feelings of fatigue. It can cause inflammation and oxidative stress, which can damage cells and leave you feeling tired. Blurred vision. High levels of glucose pull fluid from your tissues, including the lenses of your eyes, which affects your ability to focus and see clearly. If left untreated, diabetes can cause new blood vessels to form in your retina and damage established vessels, leading to serious vision problems. Also, high blood glucose levels can cause the lens in the eye to swell, changing your ability to see. This kind of vision impairment is often temporary and improves as your blood sugar levels stabilize with treatment. However, if consistently high sugar levels are not managed, it can lead to more severe and permanent eye conditions. Slow healing sores or frequent infections. Diabetes affects your body's ability to heal and resist infections. Slow healing of cuts and sores, frequent gum or skin infections, and vaginal or bladder infections can be signs of untreated diabetes. Excess sugar can stiffen blood vessels, making it harder for blood, needed for skin repair, to reach the wound. Prolonged high blood sugar levels can also impair the function of white blood cells, making the body less effective at fighting off bacteria that can infect wounds. Over time, high blood sugar levels can damage nerves, neuropathy, particularly in the feet. Reduced sensation or numbness can make you less likely to notice a wound or sore, leading to late treatment and slow healing. Tingling or numbness, neuropathy. Excess sugar in the blood can lead to nerve damage. This is because excess sugar can interfere with the ability of the nerves to transmit signals and weaken the walls of the small blood vessels, capillaries, which supply the nerves with the oxygen and nutrients. There are different types of diabetic neuropathy, and each has its own set of symptoms. Peripheral neuropathy, the most common type, affects the feet and the legs first, followed by the hands and arms. Symptoms include numbness or reduced ability to feel pain or temperature changes, tingling or burning sensation, sharp pains or cramps, and increased sensitivity to touch. Dark skin patches, aganthosis nigricans. Insulin resistance can lead to dark, velvety patches of skin, particularly around the neck and armpits. This is a condition known as aganthosis nigricans and is a sign of prediabetes or type 2 diabetes. Insulin levels in your body may rise, and excess insulin can stimulate skin cells to reproduce faster than normal, leading to the dark patches associated with aganthosis nigricans. Mood changes. Mood swings, irritability, and a general feeling of mental discomfort can also be a sign of fluctuating blood sugar levels. Both high blood sugar, hyperglycemia, and low blood sugar, hypoglycemia, can affect your mood and behavior. When your blood sugar is high, you might feel tired, which can contribute to irritability. On the other hand, low blood sugar can make you feel anxious, irritable, or even confused. To help prevent or manage diabetes, aim for a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats. Try to limit your intake of processed foods, sugary drinks, and high-fat, high-sugar snacks. Include regular physical activity as it helps control weight, uses up glucose as energy, and makes cells more sensitive to insulin. The American Diabetes Association recommends at least 150 minutes a week of moderate intensity aerobic activity, like walking or cycling, and 2 to 3 sessions of strength training. If you're overweight, even a modest weight loss, 5 to 10% of body weight, can significantly reduce the risk of developing diabetes. Regular health checkups can help detect early signs of diabetes and other health problems. If you're at high risk, your healthcare provider may recommend more frequent tests or specific preventative medications. Avoid excessive alcohol, which can lead to weight gain and may increase your blood pressure and triglyceride levels, which can increase diabetes risk. Tobacco use can increase blood sugar levels and lead to insulin resistance. Live a happy life, as long-term stress can alter blood sugar levels. Practices such as yoga, meditation, breathing exercises, or other relaxation techniques can help manage your stress levels. And always get some good quality sleep, because lack of sleep or poor quality sleep can increase the risk of type 2 diabetes. Aim for 7 to 9 hours of sleep per night. With the collective efforts of researchers, medical professionals, and each one of us in the realms of awareness and early diagnosis, we stand stronger than ever. As we embark on our new journeys of scientific discovery and technological innovation, we draw inspiration from our past triumphs and lessons. We remain hopeful, for the day is not far when we will rewrite the final chapter of the diabetes saga, not as a persistent enemy, but as a conquered foe. Until that day comes, let us remember that every step towards understanding, every effort towards a healthier lifestyle, and every push for early diagnosis brings us closer to a world free from the grips of diabetes. Together, we are the torchbearers, illuminating the path for a healthier, brighter future. Hence, knowing these warning signs can help you detect diabetes early and initiate timely treatment. If you notice one or more of these signs, please consult with a healthcare provider for a proper diagnosis and treatment plan. Regular screening for diabetes is also essential, especially if you have risk factors such as obesity, a family history of diabetes, or a sedentary lifestyle. Remember, early detection can prevent complications and promote better managing of this condition.